Hello, Kent County. I want to thank everyone who has shared their thoughts and opinions on COVID-19 and the pre-K through 6th grade masking order with me. The work session of the Kent County Board of Commissioners on August 26th was attended by hundreds of people, and I have received thousands of emails and other correspondence on the issue. I want you to know that I have reviewed the public comment from August 26th, and I do read as much of the other correspondence as I possibly can. Please know that while I respect all of these perspectives, I simply cannot respond to each of them individually. Passions run high on all sides of this issue. We all desperately want to be past COVID-19 and live in a world without public health orders, without quarantine, without canceled events, without full hospitals, and most importantly, without illness and death. Please understand that I do hear you on all sides of these issues. And yes, I have read the articles and the statistics on all sides of these issues. I don't think I can possibly change the deeply held beliefs of anyone, which leaves all of us in a very difficult situation. We have to accept the reality that we will never come to a full agreement on the science and the best policies for moving forward. Normally, in situations like this, I think it's appropriate that personal choice is the highest value. The challenge is that in the midst of a pandemic of infectious disease, issues like masking and quarantine are not really personal health medical decisions or policies. They are public health policies. These types of policies are created under authority of state law for instances in which the decisions of individuals substantially impact the health, safety, and liberty of others. Again, I fully understand and respect the fact that we do not all agree on the science of the best path forward. Because of this, state lawmakers have historically recognized this reality and that someone was going to need to make these tough decisions and to make them quickly enough to avoid preventable suffering in the community. Here in Michigan, that authority has been given to the director of the state health department and to the administrative health officers of local health departments. This is not a new challenge in America. Our U.S. Constitution is almost a century older than the discovery that microscopic organisms were causing illness. Despite this fact, from the very beginning of our republic, leaders recognized that there were times of crisis when it was appropriate for liberties to be limited for the improved protection of the life and the liberty of the community. In public health, one of our heroes is Paul Revere. Paul Revere was among the greatest of patriots and champions of liberty. What most people don't know is that Paul Revere was also the leader of the very first local health department in the United States, the city of Boston. In 1799, he was deeply concerned that the upcoming summer was going to cause a surge in yellow fever illness and death. At that time, there were many conflicting beliefs as to what caused this illness. It was a highly controversial issue. Some people believed it was caused by putrid airs coming from rotting material or filthy water, others by spoiling food. Some were convinced that shallow graves were to blame. Paul Revere understood that he had to review the information in front of him and he had to make a decision quickly because summer was coming. And so he consulted with many physicians and other experts. He then issued a public health order which required quarantine of people suspected of exposure and also included requirements for cleanliness of private and personal properties. Through this order, 1,820 people were quarantined and nearly 200 unsanitary conditions were required to be corrected. His actions were very controversial at the time because, as an appointed official, this champion of liberty and democracy limited the personal freedoms of some people for the cause of liberating people from the tyranny of disease. I hope we can have a productive conversation on the best ways to protect public health and personal liberty in the midst of a pandemic. Here in Kent County, we hope elected officials in Washington and Lansing can create laws which do just that. In the meantime, Please know that I do hear you, all of you, and we're doing the very best we can to get everyone through this crisis safely and as quickly as possible. Like Paul Revere, let's always embrace liberty and freedom, and let's also appreciate the fact that preventable disease is an invader that all Americans should rally against. And thank you for all you do to make Kent County a healthier place.